Hello everyone, it's Schematic Med, and today we're going to talk about hand bones, especially carpal bones with ligaments and MRI inside. By the way, I want to congratulate everyone who is celebrating the new year. I wish everyone a lucky year and full of new achievements. Additionally, if you have exams coming up, I hope that everything goes as planned. As always, you can find pinned minutes under the video with main specific title that's most relevant for you, or just watch video all the way through. Let's move on and talk about hand anatomy. Before we start discussing the MRI pictures, let's quickly talk about bones and their names. If we want to understand the correct locations of the bones, we need to know what anatomical position is. Anatomical position refers to the repositioning of the body when it is standing upright and facing forward, with each arm hanging on either side of the body and the palms facing forward. So you can see my hands here, and additionally I'm showing a video of me standing in the anatomical position. In this position, my palm is facing forward in a way that my pinky finger is closest to the midline of the body. Therefore, it is the medial part of the hand, and the thumb is the lateral part of the hand. This is the correct anatomical position because in this position our hand is supinated and the two forearm bones are parallel to each other. If we look at what happens during pronation, we can see that the bones cross each other, and that's why the correct anatomical position is when the bones are parallel. I am going to explain the hand joint movements in another video very thoroughly. It is very important to understand and know the bone names that are located on the same side as the pinky finger and thumb. So the little finger is on the same side as the ulnar bone, and the thumb is located on the same side as the radius. In the sectional anatomy video, I mentioned that the small bone of the calf, the fibula, is always on the lateral side of the leg. But here, when we're talking about the forearm, the smaller bone, which is the ulna, is always on the medial side of the forearm. Do not confuse these two bones. This is very logical because when we stand in anatomical position, our palm is facing up, but our soles are facing down. That's why the locations of these two bones are different. AI created this picture for me, and it created everything right except one thing. Let's start with the mistake. So we have 8 carpal bones. AI created 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. It should be 8. 2 rows, proximal and distal, 4 by 4. Next are metacarpal bones. We have 5 metacarpal bones. 1, 2, 3, 4, 5. Then we have phalanges. This is the part where our fingers are. This is the part where we can move. This part is our palm, and it is not mobile. When we're talking about the phalanges, the thumb is the exception. We have proximal, middle, and distal phalanges for the 2nd to 5th fingers, and 2 phalanges for the 1st finger, which is the thumb. I wrote the Latin names of the bones, so once again, let's repeat. We have ossa carpi, which are the carpal bones, 8 bones. Ossa metacarpi, metacarpal bones, 5 bones, and phalanges digitorum manus, manus means hand, 4 times 3 and 1 times 2. Listen to how I'm pronouncing the Latin words, and you can see how it is different from English pronunciation. Then we have carpus or carpi, in English carpi, which is the wrist. Then Metacarpus, or in English metacarpi, the palm of the hand, and phalanges, or in English phalanges. Then we see the pollex, which is the thumb, and digitus minimus is going to be the little finger. Then we have the ring finger, middle finger, and index finger. I want to warn you that the next slides are going to be very bright. This picture I drew for my older videos where I'm just saying the names of the bones, but today we're going to talk about these bones very thoroughly. Here we can see once again that the ulna is always on the medial side of the hand. We have two rows of carpal bones, proximal and distal. The proximal row bones, which are the closest to our body, include the pisiform bone, triquetral, lunate, and scaphoid bone. The distal row bones from medial to lateral are hamate, capitate, trapezoid, and trapezium. I will be honest with you. I don't like creating long mnemonics and sentences with first letters to remember the bones' names because it is not practical for me. It is firstly hard for me to remember the mnemonic and then what it means. That's why I'm not going to give you long sentences to remember. Instead, I'm going to provide you with visuals so we can understand why these bones are named like this. The only very short mnemonic that I will give you is thumb is trapped. So you will remember that the two bones that contain trap are the same side as the thumb. And additionally, the smaller bone, which is the pisiform bone, is on the same side as the little finger, as the two little ones found each other. Let's come back to our darker slides. Long ago, when naming body parts in Latin or ancient Greek, individuals often drew inspiration from the natural world around them, associating bones with elements such as the moon. So let's start with the proximal row bones from medial to lateral. In Latin, pisiformis means shaped like a pea. The pisiform bone is a small pea-shaped sesamoid bone. We remember that sesamoid bones are small bones that are located within the muscle or tendons. So the pisiform bone is a sesamoid bone which is located on the volar surface of the ulna. Volar surface means that it is located on the same side as the palm of the hand, and it is within the tendon of the flexor carpi ulnaris muscle. I am going to release another video where I'm going to talk about the forearm muscles and their functions very thoroughly. Next, triquetral bone. Derived from Latin, triquetral means three-cornered or triangular. It is shaped like a pyramid with three articular facets and is situated on the ulnar side of the proximal row of carpal bones. Next is lunate bone. In Latin, the term lunate is derived from the word lunatus, which means moon-shaped or crescent-shaped. The lunate bone is named for its somewhat crescent moon-like appearance. And finally, the scaphoid bone gets its name from the Latin word scaphoides, which means boat-shaped. This term accurately describes the shape of the bone, which is somewhat like a boat. Look at the final overall picture. It is the same order as it appears in our hand. Of course, this is just a schematic depiction and the surfaces are not correct. I hope you remembered the proximal row. Now we are looking at the distal row, again from medial to lateral. The hamate bone, in Latin, is called os hamatum. The term hamatum is derived from the Latin word hamus, which means hook. The hamate bone distinctive feature is a hook-like process that protrudes from its palmar surface. This hook is known as the hamulus, and it serves as an attachment point for various ligaments and tendons. Capitate is derived from the Latin word capitatum, which means having a head or shaped like a head. The capitate bone is located between the trapezoid and hamate bone. The name capitate reflects the bone's somewhat rounded and head-like shape. Trapezium, in Latin trapezium, means a small four-sided figure or quadrilateral, which, as we know, is a geometric shape with 4 sides, none of which are parallel. Trapezoid looks like a trapezium, but is smaller. To remember which bone is at this side, just imagine that our body wants to protect our smaller bones, so we will place the bigger one at this side and the smaller one a little deeper. Take a good look, the order is the same as in our hand. In this slide, it is schematically depicted how these bones articulate with each other. Several points I want to make. We see here that the pisiform bone is not articulating with any bones. It is swimming on its own inside the ligaments. That's why it is sesamoid bone. Next, the pisiform is on the same side as the little finger. We already talked about that. The little finger is on the same side as the ulna, which is the medial side of the hand. So if I say the pisiform is on the same side as the ulna, that will be a correct statement too. Next, we remember that thumb is trapped, and the 2 trap bones are on the same side as the first finger. One important thing that you can see is that the ulna does not have any articulation with carpal bones. All the carpal bones articulate with the radius. I'm not going to say all the joint names, but try to imagine that in this picture all the structures have articulations with each other. For example, the capitate bone articulates with the 3rd finger, hamate bone, triquetrum bone, trapezoid, scaphoid, and lunate bone. Actually, this is the image that you need to have in your head to know the correct names and order of all bones. So I have all these bones. I need structures to connect them with each other. These structures are ligaments. The 2 vertical bones I will connect with collateral ligaments. It is logical that these ligaments are at the side of the fingers, so we can bend our finger joints. Additionally, in my other video, I'm going to talk about hand blood supply, and I will mention that the nerves, arteries, and veins run laterally on our fingers because we move the joints a lot. We don't want to damage them. We will come back to this slide. In this slide, you can see good pictures of ligaments and their placements if you need more information, so I will just mention important points here. As bone joints, ligaments again connect all the bones to each other. Most of the time, the first name of the ligament is the bigger bone name, and the name gives hints to us about which bones are connected. For example, radiolunate ligament is connecting the radius to the lunate. Just remember, most of the time the first is the bigger bone name if it is not involving several bones and the name is not showing the path of the ligament. Additionally, we see transverse ligaments that connect the metacarpal bones. I want to talk about finger joint names. Maybe for just learning the anatomy, it will not make a huge difference to know the names. But when you start learning systemic autoimmune disorders, it is very important for differential diagnosis. So we have DIP, distal interphalangeal joints, PIP, proximal interphalangeal joints, and MCP, metacarpophalangeal joints. So PIP is proximal or closest to our body, and DIP is farthest. When we talk about the thumb, we do not mention distal or proximal, just interphalangeal joints. And finally, let's move on to the MRI insight. I'm going to talk in a very simplified manner, so we will just concentrate on bones and how we see them on the MRI image. We are going to talk about 3 planes: coronal, axial, and sagittal. The coronal plane divides the body part into anterior and posterior portions. The axial plane divides the body part into upper and lower portions. And the sagittal plane is a vertical plane that divides the body part into left and right parts. Let's start from the coronal plane. Once again, the coronal plane divides the body part into anterior and posterior portions. Let's try to identify the anatomical landmarks. If it was not written anything on the picture, we already can identify what bones we see here. So we see the radius and the ulna. We know that the radius is positioned on the same side as the thumb, which is the first finger. The other thing that we know is that the thumb is trapped. So two bones that we see on this side are trapezium and trapezoid. We remember that trapezoid is the smaller and deeper one. The other thing that we know is the pinky finger or little finger is on the same side as the ulna. And the pisiform bone, the smallest bone, is on the same side as well. We can see a big bone that has a head-like projection, which will be the capitate bone, which has articulation with trapezoid, scaphoid, lunate, hamate, and the third metacarpal bones. And based on our knowledge, we can try to guess other bone names. So we remember that after the pisiform bone, we have the triquetrum bone, lunate bone, and then the scaphoid, the boot-like bone. Additionally, I want to talk about two structures here, which will be two muscles, pronator quadratus and flexor carpi ulnaris muscle. Next, we will talk about the axial plane. Let's repeat, the axial plane is dividing the body part into superior and inferior portions, or upper and lower portions. Once again, I will talk about the forearm muscles and their functions very thoroughly in another video. But here, let's just quickly mention their names. At the back of our hand, we have extensors that will extend the digits or they will release bending of the joints. So we can see here the pisiform bone and we can orient ourselves. So this part will be the medial part where our little finger is located. And this is the same side where the ulna is located. Let's start from the back of our hand. We can see at the same side as the pisiform bone, we have extensor carpi ulnaris tendon, extensor digiti minimi tendon, extensor digitorum and indicis tendons, then extensor carpi radialis brevis tendon. If we have brevis, it means we have longest two. We can see here extensor carpi radialis longest tendon, and between these two we have extensor pollicus longest tendon. I hope you understand that this part is for the tendons for little finger and this part is for thumb ligament. Then we see radial collateral ligament, extensor pollicus brevis. Brevis means short. We already had the longer one and now we have the shorter one. Then we see abductor pollicus longus tendon, radial artery and vein. Then we see the flexors, flexor carpi radialis tendon, flexor pollicus longus tendon. Then we can see palmaris longus tendon. We're going to talk about that in another video about this muscle and tendon, and here you can see that it is approximately attaching to the skin. It is under the skin. It is going to create the palmar aponeurosis. Then we see very important nerve here, the median nerve. Then we're going to see the flexor digitorum superficialis. And of course, if we have superficialis, it means we have the profundus one. Same name. Just one is superficialis and one is profundus. Next we see the ulnar artery and nerve, and this side is for the ulnar side, right? And we have flexor carpi ulnaris muscle. And here we can see it is written Guyon's canal. In this canal we already talked, we will see ulnar artery and nerve. And of course here we see the lunate bone, scaphoid bone, triquetrum, pisiform, and capitate bone. In this slide, I drew schematically the carpal tunnel. So we can see the schematical picture and the MRI picture side by side. two structures that I will show you right now, but I'm not going to talk very thoroughly in this video, is thenar and hypothenar. Just remember for this video that thenar muscles are located at the same side as the thumb, and you can see here the two trap bones, trapezium and trapezoid, and the hypothenar eminence is positioned at the same side as the pinky finger, and we can see here the pisiform bone. Additionally, we can see here the capitate and hamate bone. In the MRI picture, you can see the names of the hypothenar and thenar. I will concentrate on that in another video. But here I want to talk about the carpal tunnel. Carpal tunnel is a canal located in the volar wrist. The boundaries are the carpal bones forming the floor and the flexor retinaculum, transverse carpal ligament forming the roof. The carpal tunnel contains 9 tendons, the flexor pollicus longus, the 4 flexor digitorum superficialis, and the 4 flexor digitorum profundus, as well as the median nerve. There is a condition which we call carpal tunnel syndrome. When the median nerve is compressed inside the carpal tunnel, for example when we're typing a lot or when we're leaning on our wrist a lot and longer, the pressure on the median nerve can cause symptoms that can include numbness, tingling, or weakness in the hand and arm. And last but not least, let's talk about the sagittal plane. The sagittal plane is dividing the body part into left and right portions. In the MRI image, we see the capitate bone that has articulation with the lunate bone, and lunate bone is articulating with the radius. In front of the radius, we see the pronator quadratus muscle and the median nerve. We remember that the capitate bone is articulating with the third metacarpal bone, and in front of that we have the palmar interosseous muscle and abductor pollicus brevis. In this slide, we can see the cut section where the trapezium and trapezoid are located. So, we see the second metacarpal bone that has articulation with the trapezoid and trapezium. The trapezoid is articulating with the trapezium bone, and then both articulate with the scaphoid bone, which is articulating with the radius. In front of the radius, we see the pronator quadratus muscle and the radial artery and vein. In front of the second metacarpal bone, we see adductor and abductor pollicus brevis, and at the back the dorsal interosseous muscle. In this image, we can see the trapezium a little more clearly. Once again, I'm not talking very thoroughly about the muscles because I will have another very thorough video about the forearm muscles, the layers and their functions. Thank you very much for your attention. Bye.